We also want to focus on the role it's played in the spread of AIDS. Today is World AIDS Day, a date which also marks the 25th anniversary of HIV/AIDS in the United States. My next guest says, despite scientific advancements in industrialized nations, the epidemic continues to rage in developing countries and victims are falling off the radar screen. Joining us now with his perspective, Dr. Arthur Fournier, a 25-year veteran fighting the HIV/AIDS epidemic. He's author of the book, The Zombie Curse, dealing with poverty's role in the spread of AIDS, and he's currently Associate Dean for Community Health Affairs at the University of Miami, Vice Chairman of the Family Medicine and Community Health Department. Welcome, Doctor. Thank you for joining us.
My pleasure.
I think a lot of people think that we have developed a cocktail of drugs. It's working to keep people alive in the United States. And so AIDS is not really that big a problem anymore. But that is not the case.
Absolutely correct. And I think one of the reasons why we need something like World AIDS Day is to keep people from getting complacent. We're very complacent here in the United States. Meanwhile, the number of people dying from AIDS keeps increasing. The number of people being infected keeps increasing. And the effect on economies in developing countries and in poor corners of the United States is enormous.
That is a very important point. We know that there are very high infection rates in Africa to the point where economies there may not be able to develop and we may have to carry them. And what people don't realize, I think, is the same thing's happening in India and China, even if we don't have quite the same statistics.
Well, I'm only familiar with Haiti and the inner city of Miami, but I can tell you the virus, if it reaches a critical mass, will cripple economies. There's a huge problem in Haiti, for example, with orphans. There's at least almost 300,000 institutionalized orphans in Haiti. There's a new phenomenon called elder orphans. These are old folks who used to rely on their children surviving and taking care of them if they were lucky enough to survive to old age. Now they don't have anybody to care for them.
It is the same, I know, in these other countries. I've traveled to a number of these AIDS centers there, but poverty seems to be the thing that connects all of these issues together in these developing countries.
It's the driving force behind the epidemic. This is such a smart virus. You know, it's learned how to attack our sex drive, our immune system, and our socioeconomic order. And people are still hung up. They think of it as a lifestyle disease. It's morphed into a disease that's exploiting the poor and taking advantage of the survival choices they have to make in order to perpetuate itself.
Yeah, explain how that works. It's not as much a sexually transmitted disease outside the United States.
It very much is a sexually transmitted disease, or you either get it through having sex or you get it because your mother has it and you're born with it. But there are forces that are driving the epidemic fueled by poverty and inequality. What introduced AIDS to Haiti, it's not the fact that you're Haitian that says you're going to get AIDS, it's the fact that you're poor. It was sexual tourism. Sexual tourists, both gay and straight, for the United States, who came to Haiti because the country is so poor. In my book, I mention the first visit that I was there, children were begging for used Dixie cups. If you can imagine that. That's how destitute they are. I was listening to the earlier segment of your program, and that's what, 90% of Haiti is destitute. They're living on less than $2 a day. Actually, they're living on less than $1 a day.
Yeah.
And under those circumstances, the double standard between men and women, the fact that women have to marry young, the fact that they have to feed their children, the fact that they can't say no to policemen because there's no real rights for them, the revolving door we have in this country between prisons, the homeless, the mentally ill, all of these are socioeconomic determinants, and they're what's driving the infection amongst the poor.
Yeah, let me clarify. I didn't mean it wasn't a sexually transmitted disease. I meant it as the sexual lifestyle as we think about it in the United States. Given those criteria, given the transmission, given the situation people find themselves in, what can we do?
Well, I think that we can win the war against AIDS, but it's got to be one community at a time. We've been blessed down in Miami. We started a small charity, Project Medishare, which I talk about in my book. A local foundation, the Green Family Foundation, has really taken a different approach to philanthropy. You've got to engage with the people you're trying to help. We were invited by a community in Haiti to come up and help them. It's actually a remarkable story. And because the community wants to improve their health, we've been able to work with them and go from no health care through episodic health care when we came to visit to now a permanent health care system. And in the process, we've been able to create a middle class, some alternative to just subsistence farming there. And I think that's been a big part of our success.
Hold that thought. We want to talk a little bit more about it. Dr. Arthur Fournier, he's the Associate Dean of the University of Miami's Community Health Department, but we have to take a very quick break. Stay with us. On the Economy continues. It's World AIDS Day. We're looking into the role that poverty plays in the spread of the disease. Well, we are continuing our conversation now with Dr. Arnold Fournier. He's a 25-year veteran of the HIV/AIDS epidemic, and this is World AIDS Day. Dr. Fournier is currently Associate Dean for Community Health Affairs at the University of Miami. Doctor, you were talking about a project that you have down there that has had some success and that we need to attack this one community at a time. A lot of people think the big question is money, that the government of the United States and world governments are not spending enough on the disease. Is that a problem?
Certainly I'd like to see more spent, but money alone isn't going to solve the problem. It's got to be money well spent, well planned for. If you just threw money down from on top of Mount Olympus, the problem would continue. So you've got to have grassroots engagement, very creative thinking, and you've got to march socioeconomic development along with health. You also can't just treat AIDS by itself. You've got to create an infrastructure for health. And again, even in this country where so many of our patients don't have access to health care, the only patients I see on the wards at Jackson Memorial Hospital anymore who have HIV are those that don't have access to care.
And that's got to be a particularly big problem in a place like Haiti, where the medical system is so poor.
It absolutely is, but they're creative solutions. We've used people from the community, community health workers, again, thanks to the generosity of the Green Family Foundation, go door to door, give out medicines, give out education, encourage people to live healthy lives, and inspire them. And in the process, we've created a middle class. They're doing prenatal care, they're doing immunizations, they're doing direct observed therapy. We've got 700 patients or more who've completed direct observed therapy for TB. Every one of those patients would have died. And they're people young in their productive years and their children who we've saved their lives. We've got 100 patients or more on direct observed therapy for HIV. They're working again. There are solutions, but we've got to think out of the box because it's a smart virus and it's outsmarted us until now.
Well, before we let you go, bring us up to date on where we are with medical research. How close are we to a vaccine that would prevent this disease, and what about the drugs that do treat it?
Great question. I think the progress on the scientific level has been enormous. The drugs have enabled those who are able to get them to live a normal life. It's turned this disease from a uniformly fatal disease into a manageable disease. But the problem is, if we only put emphasis on treatment, we're not going to stem the flow of new cases, and we're not going to stem the flow of the disease amongst people who don't have access to care or have hope for a life. I mean, the lack of hope is the philosophical counterpart of the economic side of the equation. You know, if you can't feed your kids, if you can't send them to school, if you're forced into prostitution as a survival strategy, how are you going to think about safe sex? I mean, it's impossible to think about it. So again, the two have to go hand in hand. I think, you know, we're all victims of the penicillin syndrome. You know, we think medicine is all about curing things. I think we have to emphasize prevention, education, but most importantly, we have to give hope to the people we're trying to help.
A very good way to wrap things up. Thank you very much, Dr. Arthur Fournier, Associate Dean of the University of Miami's Continuing Health Affairs Department. Well, turning now.